Good afternoon. Dr. Alfred Dawes, Member of Parliament for South East St. Catherine and Shadow Minister of Health and Wellness. When Hurricane Melissa hit Jamaica, it was a catastrophic natural disaster. If we continue on this path where the government maintains hegemony over the distribution of aid and access to the most vulnerable communities by volunteers, if they try to do it alone, we will have an even more catastrophic man-made disaster. We are seeing a humanitarian crisis unfold before our very eyes. Ground Zero was in eastern Westmoreland, a parish that I'm very familiar with, and the devastation that is seen there and in St. Elizabeth and in other parts of Westmoreland, St. James, Hanover, and St. Elizabeth overall. It is mind-boggling. No pictures or videos can do justice for what you see when you're driving miles and miles. The smells of rotting carcasses, the flooded roads. Healthcare has been teetering on the border of collapse because of the situation at Cornwall Regional Hospital and the overcrowding in the feeder hospitals. What we're seeing now is an exacerbation of that situation, where Lucy Hospital, Noel Holmes Hospital, is pretty much non-functional. Up to over the weekend, there was no way of contacting hospitals for referrals. They would just get critical patients as fast as possible loaded into an ambulance and send them off with a hope and a prayer and what limited staff they can afford to send on that journey. The Black River Hospital has been devastated, and Salvamar Hospital, they have major infrastructural challenges, but even more so, the staff, they are also homeless. They are also living out of cars. Many of them are hungry, and many persons cannot provide health care because they do not have the resources. We appreciate that the government has now opened the NHS stores and has started to send out supplies. But we must not be fooled into thinking that a field hospital being set up means that it is an appropriate response to a catastrophe of this nature. A hospital is secondary care. There is no primary care in any of the affected parishes at the moment. This means that the clinics are closed. It means that diabetics, hypertensives, persons with heart disease, kidney disease, those who have a diabetic foot ulcer, they are not being treated. And it means that they are going to have exacerbations and complications of their diseases. And already we are seeing where those who have access to the hospitals have been flooding the hospitals. We will see in the ensuing weeks an increase in mosquito-borne diseases. Within 6 weeks, we can expect outbreaks of dengue and whatever else is lying around, waiting for these appropriate conditions to manifest. The public health inspectors, they need to be empowered immediately so that they can start their food safety checks. They can inspect for water sources that they are potable, they have not been contaminated. Basic materials such as food temperature thermometers must be provided. We must increase vector control activities immediately, and this is not just fogging, but source control. Otherwise, we're going to see a massive outbreak of dengue. The gastroenteritis from the consumption of spoiled foods, already we hear reports of persons eating rotted or rotting carcasses. And the unavailability of potable water will lead to diarrhea, dehydration, and in the most vulnerable, the elderly, the children, and the pregnant mothers, it may mean death. We do not know what the true death toll is from the hurricane, but what we can expect is that if these public health issues are not addressed immediately, we're going to see far more deaths occurring in the aftermath of the storm, in this man-made disaster, than what occurred during the passage of Melissa, the natural disaster we're here to speak about. We must head this off. We must resource the hospitals. We must send relief staff to the hospitals. We must find a way to get health care in the communities that have been cut off up to recently and are still cut off. And the way we may fill that gap is by inviting and coordinating the hordes of volunteers who want to go in and give some health care. Medical missions have played a very important part in the provision of health care in far-flung communities. And it is this provision of primary care, the screening, the early intervention with the medications, the dressing of wounds, that have kept many persons from seeking health care at overcrowded hospitals. If we have dilapidated structures, if we have damaged structures that are understaffed, it is reasonable to ask that volunteers be coordinated to go and man these health centers in the rural communities through the different medical missions. So these things must be coordinated immediately. Organizations that want to donate food and especially water, they must be accommodated. I've had complaints and I've tested the system myself, and I don't want to be overly critical. That is not the tone I want to project here today. But those who want to give are being frustrated by the process, and what is happening is that they are trying to make the journey themselves. The roads are blocked up. On our mission on Saturday, one of the buses broke down and the relief bus took about 4 or 5 hours to make what would normally be a 2-hour trip to relieve the staff that were left on that bus. The roads have been congested, and it is frustrating persons who want to donate, but we must set up a proper distribution network so that those who are impacted the most, irrespective of their antecedents, they get the resources that they need. It means not simply focusing on one particular area, but accepting that this hurricane tore through the entire Western Jamaica, and we must not ignore the plight of those who are in one parish. If the information that came to us through the media came late and our attentions were already fixed on a particular area that was brought to the forefront of our consciousness. So in conclusion, my appeal is that we find a way to facilitate the donors of foodstuff, sundries, health supplies, and importantly, find a way to channel those who want to give service in the medical field so that we can organize relief missions to go to the communities that Nikisha spoke about, that Zulika spoke about, and others are bringing to the forefront of the nation's consciousness. We have to get medical missions into those communities, and we have to, they are coming with their resources, but there needs to be a greater collaboration between those entities and the government and the state agencies, as well as the opposition, because we have made ourselves available to work alongside the government. So again, we do not want to convert a natural disaster into a man-made disaster because of partisanship, but we should focus more on partnership. Thank you.